Vitamin D is very important. A lot of people think of it on the human side back to bone strength and structure support because it plays a role in calcium and phosphorus metabolism. So it's all interconnected, very complex to get into, but definitely important from that aspect. There's a lot of research and data to show that vitamin D plays an important role in immune function. So there's a lot of health benefits that can be tied back to vitamin D. And then we've seen data across species, and we're seeing it on the beef side now as well, that we're generating new data, seeing improvements in carcass yield and those growth or performance outcomes that are really integral and important on the side of the beef industry side of things.
If you look at vitamin D levels in beef cows and in calves coming into feedlots, all of them, everybody believes that D is synthesized through the skin, which is true, and so you should have an adequate level. But through testing in the blood, we find out, especially in certain times of the year, you'll almost be deficient in vitamin D, and even in the summertime, you're below adequate. So we've done some testing and actually had a test in a large feedlot in northwest Kansas where we did seasonal testing. We went in July, September, January, and in April, and we tested what the 25-hydroxyl vitamin D levels are, the serum levels in the blood, and what we found out was there's definitely a seasonality. Length of day makes a big difference on how much D is synthesized through the skin. So in the wintertime, we were just barely above 30 nanograms per milliliter, which is almost deficient. In the spring and the fall, they were very close to the same, close to 50 to 60, and then in the summer they were almost 90. So, and 100 is what we deem adequate. So they were 90 to 100, depending on the steer or heifer that we tested. Trying to figure out a way. Most people feed vitamin D3, and vitamin D3 has to go through the liver and then is transformed into 25-hydroxyl vitamin D. Well, what we do is we will feed our high D product, which is 25-hydroxyl vitamin D, and it bypasses the bottleneck of the liver, because the liver is a very overworked organ, in my opinion, if you want to look at it that way. And so you can only do so much. You can't just feed more D3 and raise those levels where you need to, and actually you'll end up having a toxicity of D3 if you try to do it all through feeding vitamin D3. So feeding the 25-hydroxyl vitamin D bypasses the liver, gets in the bloodstream, and then it goes through the kidneys and is transformed into the 125, which is utilized by the body. We've got people that are feeding in their starter calves. We also have guys that will want to boost their levels in cows all year round. You can go and take serum levels and see that, and they will tell you they have healthier animals they feel is due to the vitamin D that they're feeding.